Right. So, Dr. Rucker, you and I have been a long-term friends. 4 or 5 years we've been since I've been down in Florida. We've been good friends, but you've been mostly my physician, but we're also become good friends, and we're on this venture together with our reverse medical company. Now, the next big topic I wanted to talk to you about, and this topic's near and dear to me, and that is testosterone replacement therapy, or HRT or TRT. It comes in lots of different forms, and we can see it all over the country now. And it really is managing a male or female who has gotten to a point where their body, their own physiology is starting to fail them. And it fails them, to me, in a number of different ways. One, just general recovery from activities of daily living, recovery from sport activity of daily living. And then you combine the two of them, and we have this shrinking mass of human being with an increase in adipose, or BMI, body mass index, and a decrease in muscle mass. And therefore we have the perfect rumination for long-term chronic disease, right?
Absolutely.
So testosterone seems to start to wane, usually somewhere around the early 30s.
Yeah.
They go from, we can talk about the lab values just really quickly. It means nothing to most people, but maybe 600 or 700 milligrams per deciliter, and it starts to drop down to the 200 or 300. And then we have the side effects of erectile dysfunction, hair loss, because we do have some of this testosterone will become dihydrotestosterone, and that will attack the hair follicles, which we have a product for that. Tell me what testosterone is as a molecule for males, and how do we use it best to supplement people to take them to the next level, or keep them at a level they want to be?
Yep, very good questions. I think any discussion of testosterone, the first background piece of information that I would share and look at is the typical old school conventional look at testosterone and what areas of that is wrong. Number one, a lot of conventional family doctors are scared of testosterone because the old thinking was, oh, it's related to prostate cancer, okay? So I'm gonna go backwards to answer your question. Number one, the mistakes made with conventional medicine are it's related to prostate cancer, and number two, well, too bad, low testosterone is part of aging, deal with it. So if you think about it, the conventional go to your regular family doctor office, they're just gonna accept that. And instead you highlighted what are all the problems males get into by having a natural decline in their testosterone. Well, it leads to muscle loss, cognitive problems, sleep problems, concentration problems, energy problems, problems in the bedroom. Okay, all those are problems of aging. So testosterone is at the cornerstone of all that. So in summary, I'm telling you, testosterone is important because it affects all those pathways, and on top of that, it is not associated with prostate cancer, and it should not be left alone. So testosterone should be viewed as the cornerstone of an anti-aging program, and hence the word reverse in the name of our clinical platform.
Right. So to me, testosterone, and I've been on testosterone therapy for a decade, what it has done for me is it's allowed me to get to 61 years old and still have the physiology, I think, of someone who's in their mid-30s. I'm not a bodybuilder. I'm not trying to be a sports hero. I'm not trying to do any of those things. I'm not even a weekend warrior. I'm not trying to beat anybody. I'm just trying to maintain my own physiological health by replacing a molecule that gets depleted over time because, hey, we're living longer. So that depletion of that molecule has a lot of long-term effects in my activities of daily living if I did not have some additional treatment that you've given me over the years.
So to answer another one of your questions, testosterone is a hormone that's important for men and women. Another informational part of our website will have these aspects related to women, but as for men, it is the key hormone that gives men the masculinity. Obviously, women have femininity through balance of estrogen, progesterone, and testosterone. Men, testosterone is a dominant feature that allows a man to have masculine attributes. That would be, strength, the emotional makeup and mentality of being a man, and the youth and vigor of being a man. That's where the concept of helping stave off erectile function, erectile disorders, etc., through testosterone. So testosterone is a cornerstone molecule that's embedded in the male biologically, physiologically, and psychologically. It has effects in all three domains.
So always, if I read the literature, and the literature is usually about 20 years behind the time sometimes, especially textbook literature, is the prostate issue is probably the biggest thing. It's like if you take testosterone, you end up with prostate cancer, and the other big issue is that somehow it's going to force you to lose hair, and you're somehow cheating if you are using testosterone.
Right.
So can you explain that the levels that we're using here are not something you would see at a high level athlete or someone who's in bodybuilding, where you see these massive human beings that have decided to go a different route? Because that's not our route.
I'm going to start with a simple analogy that people can take home if they want to think about it. If you have a loss of vision, let's say it's leading you to have to wear eyeglasses and contacts at night, it's completely acceptable for you to go get LASIK eye surgery, a laser adjustment of your eye lens, and now you can see better. That makes sense. Well, same here. Hormonally, instead of vision, it's represented in a different man of the body. So all you're doing is correcting something that's gone the wrong route due to aging. And that's the same with your eyeball. The eyeball ages, you can't see better, you have a little surgery, boom. Here, you can't have a surgery that changes the testosterone axis, so you replace the molecule that's gotten lower over time. See, doping in sports, the difference is that wasn't really supervised by a medical doctor, a licensed medical doctor. All right, fine. Doping in sports is usually backdoor, chemists that aren't licensed, allowing athletes to do unsafe things. So when you are working with a licensed physician who understands integrative medicine and anti-aging, number one, we follow up with our patients and monitor any potential for side effects. Every time you take any substance in the world, there's always a potential for a side effect. So
Sure.
That's why we have a licensed medical doctor who's a hormonal expert, me, helping our patients through these aspects of care so they can be managed in an incredibly safe manner. So that's what gives us safety.
Yeah, so I've been in sports a long time, a lot of different sports, and I always heard about the backdoor coach who was always on the black market, getting stuff from Mexico or some other part of the world, and then sort of spreading that throughout gyms or whatever,
Right.
through team sports or whatever it has been. This is completely different because we have not only a licensed medical doctor, but we have one of the best medical doctors that understands these hormone issues and can properly prescribe a properly compounded molecule and give you dose specific corrections. And everybody's going to be a little bit different about that, isn't that right? Everybody's going to have a 30-year-old on TRT or hormone replacement
Absolutely.
therapy is going to have a different molecular amount of injectables.
One size doesn't fit all.
One size doesn't fit all.
So-
I was trying to get to.
Yeah, I have some patients that, this is what I'll explore with the patient. I have patients that might say, "Doctor, I'm scared of needles. What can we do?" All right, then we're going to specially compound a cream. Or they'll say, "Doctor, what do you think's the best?" I think our injection protocol is by and large the best. "Doctor, where should I inject? The arm muscle, the gluteal?" So every patient's going to be different. So that's the aspects of therapy we're going to customize to each patient.
I think that's brilliant because your coaching, medical supervised coaching, is something that is widely missed in this whole population of testosterone replacement therapy or hormone replacement therapy. Still, there are a lot of doctors in doctors' office that are using lay people to go out there and cobble up human beings and push them into a program. They don't get the proper supervision. They don't have access to the medical doctor, and they're just guessing their way through most of it.
It's funny. I'll tell you, to me, one of the funnier stories that affected my career was when I was a standard conventional urologic surgeon. The men would come in and we put them on androgel. And so if I put 100 patients on androgel, 70 of them would fail. That's crazy, but that's the typical product they use in the family doctor's offices. So there are millions of men not being treated properly. So the first question, we've never talked about this, is why does androgel fail? Well, it's a terrible product. It's not made properly, and when you rub that gel onto the skin, most of it gets turned into estrogen in the body. So it's not compounded. It's a bad product.
Right.
So instead, all those millions of patients are getting the worst product through their doctors. So we're giving them the proper, potent, cutting-edge products because we're customizing our medicines per our patients.
So talk about that really quickly. What is that process where how can testosterone turn to estrogen? What's that called?
Okay. So the word is aromatase conversion. So aromatase is an enzyme that floats around in all our men's fat cells. So testosterone gets converted directly into estradiol by aromatase. So that's going to be the first question a lot of men have. Oh, well, I heard there's something called a aromatase inhibitor, a blocker. Should I take that? So these are the concepts of customizing per each patient. A lot of clinics you'll walk in and you'll walk out with, well, they got me on HCG, they got me on anastrozole, which is or Arimidex is the aromatase inhibitor, and they automatically put me on even thyroid. So there's no cookie cutter automatic template that every person has to have. Instead, each person needs to have these columns looked at individually, but that's one of the top side effects of testosterone usage that we want to avoid, and that just takes proper monitoring and education per patient.
Right, because not every male is going to aromatize testosterone
That's
and estrogen at the same level.
At the same level.
Or even at all. Some people might not aromatize at all.
Or it's just acceptable. Sometimes it's acceptable. Now, I don't want to get into complicated numbers, but for our viewers at home or sitting there watching this, 5% of all the testosterone gets converted. So simply enough, if you see estrogen levels that are just 5% of the total testosterone, that's totally acceptable. So that's just the start of how do we figure this out. But if a man develops breast tenderness, breast swelling, we are very aggressive about blocking their testosterone to estrogen conversion.
Because they're starting to develop gynecomastia.
Or symptoms.
Symptoms of gynecomastia.
Correct.
And
breast swelling and breast tenderness.
The nice thing is that with your coaching and your easy access through our website and our telemedicine and online scheduling, you can get an appointment with you instantly and go, hey, listen, I'm having a problem. What can I do about it? And then instantly you can upgrade the package so that it works for them.
Efficiency.
And so we have this efficiency built not only in our molecular world, but also in our
platform.
Our platform, our customer. So our customer has the best access to the best knowledge in a very, very quick period of time. So making an appointment isn't like 2 months down the road. Making an appointment might be 2 days down the road.
That's right.
Just look at our schedule, and then they can get on the board with you, whether they're a new patient or a recurring patient. Once they're on our subscription service, they have 100% access to you. Is that about right?
Absolutely.
Yeah. And finally, I wanted to talk a little bit about what is the role of some of these other compounds, like using thyroid or use the word HCG. What do these things do, and why would they show up in a 30 to 60, 70-year-old population? What's happening to the physiology of the body where we have these intrinsic failures that we call aging, but they're intrinsic failures that actually have a solution?
Right. Well, in terms of testosterone management, some of the common questions patients are going to have are, what are the typical side effects a man could have? What are the typical side effects a man could have for testosterone usage? Number one, a patient can develop acne. Number two, a patient can have more hair loss than they might otherwise anticipate. So both of these, we look at the patients on an individual basis and treat the side effect, which might number at a 5% rate. Number three, patients can experience at a 5 to 10% rate testicular shrinkage. So that's why HCG injections have been used. Number four, you will see 15% of patients that already have low testosterone have a low thyroid function. So thyroid and testosterone decline can go hand in hand with aging. Obviously, aging is not an optimized experience. If it were, as we aged, we'd continue to have a longer lifespan. But as we age, we have a shorter lifespan. So our job is to try to give our patients the maximal quality lifespan and hopefully create a lengthening of that lifespan. But
Right.
that would be ridiculous for people to try to offer, a time limit on how much aging they're going to limit for the patients. But instead, optimization of the time you have on this planet is what you have embodied. That's why you're our first patient, our co-founder, and our friend of our platform.
It's been interesting because a lot of people don't really know what the thyroid does, and the thyroid basically is producing T4, which gets converted to T3. The T3 goes to all the cells in your body, every cell except the red blood cells. The only one that doesn't have, quote, the mitochondria or the engine that makes ATP, which is the actual molecule which fuels your ability to move out through time and space and think and move and do all these kinds of things. So it's incredibly important to have these two molecules at optimal levels, not at super physiological levels. We're not trying to be those guys that are trying to win Olympic medals, world records, or anything. We're just trying to get people to have a slowing of their physiological aging to a point where they have a higher quality of life. Is that about right?
Absolutely. Yep, the thyroid's the master metabolic gland, sits right here and overlooked by many doctors.
I agree.
And instead, for the reasons you said, it's very important for mental health, metabolic health, and aging.
Yeah, it's incredible how little medical doctors included, other healthcare providers discount the thyroid by doing that one simple test, and they look for thyroid stimulating hormone, and if that's within the normal range, and the range, if you look at LabCorp or Quest, is gigantic. You drive a truck through it, so it really doesn't pinpoint exactly what's wrong with people.
Same with testosterone.
Same with testosterone.
Right.
They have these wide ranges, which might be lab ranges, and we know lab ranges are just a compilation of mathematical formulations, and it has nothing to do with double-blind
It's sad. It
studies.
almost means that, hey, the 99% of people that are alive, that's where they are. Well, that doesn't help you just to be alive.
It doesn't.
Like you said, alive means you can drive a truck through it. We're trying to optimize.
Right. We're trying to get into a functional range where people can go, all right, I'm physiologically combating a slowing of my physiology and upgrading myself to upgrade quality of life, quality of interaction with other human beings, and the quality of movement throughout time and space. To me, that is the most important thing that I've gotten out of it. Is not to be big and powerful, but to just be physically capable of continuing to do the things that I want to do, whether it's skiing or golfing or playing tennis or doing jujitsu or boxing or running or cycling. Anything that you want to do, you can still do. Not at a Superman level. I don't want to be a Superman, but at least at a level where I can still hang with my friends, we can still have a good day, and I'm not exhausted at the end of the day. Is that about right? So my quality of life goes through the roof, and because I see other guys that poo-hoo the idea. It's like, oh, well, you're doping or you're doing something, you're cheating. It's not. It's really
That's what
just
I use
replacing.
the eye surgery example.
The eye surgery example is the probably
It's
the
not
best one.
cheating. It's just getting patients optimized and functioning at the highest level they can.
Yeah, and I love the fact that you are the ultimate coach that is available 24 hours a day. We're on our calendar, available at a moment's notice without driving, making appointments, talking to a bunch of people. Just get on our calendar, make the appointment, whether it's a new patient or a follow-up, done. And you can analyze that patient and figure them out almost instantaneously, because we know where the physiological failures are in most people in the aging process.
Well, because of all the factors we just mentioned, I'd like to suggest the two things that our patients are going to gain from our platform are simplicity and efficiency.
Right.
Two important things when it comes to their time.
Yeah, simplicity and efficiency, and I can still go to my primary care for just anything else. When I think back to my other primary cares, waiting because of the inefficiencies in his system. So if he gets backed up with the patient, guess what he does? He puts it on your schedule. So now you're there for an extra hour, hour and a half, waiting to see the doctor for a 5-minute conversation. This way, we have taken all that away. We flushed it down the toilet, so to speak, and we put efficiencies right at the top of the model that we built.
Correct.
Okay. All right. Well, thank you for taking your time and talking to me about this really, really cool topic. To me, it's very cool, very interesting. It's valuable for anybody from 25 to 75, 105. You have to talk to Dr. Rucker about how you get involved with testosterone replacement therapy or hormone replacement therapy, because it's absolutely critical for your quality of life as we grow older and we live longer, and we want to be more effective in both our personal lives and our family lives and our job lives and our interaction with the rest of the world. Thank you very much.
Thanks. Get in touch with us. That's what we're here for.
All right.